Welcome back to another episode of Spirit of an Athlete. I'm your host, Amanda Smith, and on this episode, I invited Tracy Frankland, a marathon runner who discovered she had breast cancer. She is also a nurse who has been in practice for over 30 years. So you can imagine that she was acutely aware of what was going on in her body. In this episode, she shares her journey as well as her journey to becoming an advocate and coach for cancer survivors. I truly hope that you enjoy this episode. It is truly moving. Tracy, thank you so much for saying yes to being on Spirit of an Athlete and sharing your cancer journey with us.
Thank you for having me. I'm so glad to be here to share awareness.
Yes. Okay. So, set us up. What were you doing when you found out that you had cancer?
So I'm going to back it up just a little because there's an interesting piece that will become important later when
Okay.
I tell my journey. So in October 2011, I was watching a movie. It was a Sunday. And this movie happened to be about a physician by the name of Dr. Dennis Slauman. The movie's called Living Proof. And I was watching this movie because it had Harry Connick Jr. in it. And I thought, well, who doesn't like Harry Connick Jr.? Right? So I thought, I gotta watch this movie. So Dr. Slauman actually was the inventor of a drug called Herceptin. So before women, when in the 80s, when they were diagnosed, 80s and 90s, when they were diagnosed with HER2 positive breast cancer, that was a death sentence. So his drug Herceptin that he invented actually was the drug that saved women who were diagnosed with HER2 positive breast cancer and gave them a chance at life, and actually has a really great survival rate for that particular type of cancer. So while I was watching this movie, I thought to myself, you know what, I got to do a self breast exam because, I haven't done one in a while. And I'm someone who always thinks, you know your body best. So waiting for your physician who you only see once a year to figure out what your breasts feel like is really not a great idea because he doesn't know what your body's like. You do. So I went in the bathroom, I did my self breast exam, and on the right side, I felt a lump. And when I first felt it, I thought to myself, did I really feel that? Or is my mind just playing tricks on me because I am watching this movie, right?
Right.
So I went back to watching the movie. I went back into the bathroom. Sure enough, did another self breast exam, got into all the funky positions. And sure enough, it was there. Went and got my husband. I said, do you feel this? He's like, I don't feel anything. But to me, it was something was there. So I made an appointment the following Monday and I went to my family doctor. He did the self breast exam. He did not feel the lump. He said, but I will take your word for it. We'll send you for a mammogram. So I'm adopted. And I had literally only a couple of years prior received my medical information from my birth mother, because at the time you're only allowed by the government at that time to only get one parent's medical information, not both, because why would you want both?
Wow.
I know.
Canada.
So
I want to
yeah,
clarify for everybody. That's Canada.
that's Canada. Now records are open, but still there are some still hiccups. Anyway, so I only got hers, but she had breast cancer. So he knew that. I knew that. So he said, we're going to send you for a mammogram just to make sure, probably nothing. And then your mind will be clear. So went and had a mammogram. And when I was sitting there in the mammogram, after everything was done, they said, just wait here. We just want to make sure before you go that we got the images we wanted. I'm like, great. So I'm in healthcare. I'm a nurse. I've worked in the operating room for decades. I've seen a lot of imaging on the screens when we do certain procedures for breast cancers. So they must not have turned off their TV that they had in the room that I was in, because all of a sudden up popped my images. And I was like, wow, look at that. There's something there.
Yeah.
Having said that, it was a perfect round circle. And I was like, that doesn't look like cancer. So maybe it's just like a cyst or an adenofibroma. Those are benign things. So I'm like, maybe it's that. Okay, no problem. And I go and my doctor's like, you know what? Let's just send you for a biopsy just in case. I'm like, okay, yeah, let's do it. So I go for the biopsy, and this should have triggered me in my mind. My medical mind should have kicked in when the radiologist was saying to me, we're going to take some samples. It looks like a cyst on here, but just behind it. And he kept turning on the Doppler on and off, which tells you about blood flow. One of the things cancer cells like to do when they clump together is they like to create all this vascular stuff coming into it. So he kept turning the Doppler on and off, and I kept hearing the blood flow. That should have triggered me to think maybe there's something wrong, but it didn't, because denial is powerful. And
Yeah.
I feel like, looking back, that I was very much in denial of what was happening. So then 2 weeks following that, I go to my appointment to meet the surgeon. It was at my hospital. So the surgeon that had to tell me I had cancer was somebody who I'd worked with for 10 years. And he came in the room and he looked at me and he said, "You have breast cancer." And I was 39 years old. I was training for my very first half marathon. I had been an avid runner for years. I was in the healthiest shape I'd ever been, physically, emotionally. I was eating as clean as can be because I was training for a half marathon.
Right.
And I got this diagnosis. Here's the interesting thing. My cancer was HER2 positive breast cancer. So if I had been a few decades earlier, that would have been a death sentence for me. But because I was diagnosed when I was, and because that doctor persevered and got that drug created and made for women, I am sitting here 12 years later, almost 13 years later, in front of you having this conversation because of that drug. And because I listened to my intuition that said, go do your breast exam.
Mm-hmm.
Something in me said, you must do this. Go do it. And so I was stage 1 breast cancer, and mine was invasive ductal carcinoma. So it was a more aggressive type of cancer. And so I had surgery first because the tumor, what happens when you are diagnosed with cancer, your surgeon, oncologist, radiation oncologist, everybody, all the medical oncologists get together to determine what would be the best course of action based on the type of cancer you have, based on what it is, invasive, lobular, triple negative, whatever it is, what's the best course of action for you? So for me, surgery was step 1, and step 2 was chemotherapy. So when my doctor the surgeon gave me this diagnosis of breast cancer, I was faced with options of, okay, what surgical option did I want? Did I want a lumpectomy with what they call a sentinel lymph node biopsy, which is taking lymph nodes from your armpit to see whether the cancer has spread into your lymph nodes? That's the closest set of lymph nodes.
Mm-hmm.
And that determines your stage as well. Or did I want a mastectomy? So based on my family history, knowing the history I got from my birth mother, I chose to do a bilateral mastectomies and sentinel lymph node dissection because I wanted to be able to sleep at night. And knowing that I was now 3rd generation breast cancer, that for me was what was going to help me be able to move forward.
Mm-hmm.
And the doctor actually advised me against it because he said, lumpectomy gives you the same chance as, a mastectomy in terms of survival.
Mm-hmm.
And those statistics are very true. Again, for me, my choice was to go a bit aggressive. And I'm glad I did, because when we did the mastectomies, the bilateral mastectomies, my cancer was in the right side. When they did the pathology on the left breast, they actually saw that there were already what they call hyperplasia cells on the left side already. What hyperplasia cells mean in English is the cells were already starting to change, and they are what we call precancer cells. So if I hadn't have taken the left breast, I probably was going to be doing this breast cancer journey again. And even my oncologist, when I met her, she said to me, "How did you know to save your own life?" And I said, "I didn't. But my intuition said to me, this was the right course of action for me." So I'm not saying every woman out there amputate your breasts, because that's what it is. It's an amputation.
Mhm.
What I am saying is you've got to listen to your instincts and your
Mhm.
gut, because it will guide you to which way is the correct way for you to go and what path you should be on. For me, that was my path. And I was also very lucky because when I decided to do a bilateral mastectomy, I had the option of having reconstruction done at the same time. So for a 39-year-old woman, I was able to go to sleep with breasts and wake up with breasts. Fake, but they were there.
Mhm.
And that for me was also about body image, and I was young. Now, would I make that same choice? I'm not sure that I would, because I'm 52. But back then at 39, that was a choice that I wanted to make for myself. So I was able to go to sleep with my breasts, wake up with the fake breasts. And then my next step was chemotherapy. So because I was young and it was aggressive, they wanted to make sure that I had the best chance. So I had 6 rounds of chemotherapy, 3 drugs in rounds 1 to 3, and then 2 drugs in round 4, 5, and 6. Because of the mastectomies and where my tumor was far enough away from my chest wall towards the skin, and I
Mhm.
had bigger breasts back then, I did not require radiation. And that's one of the reasons why I was able to do reconstruction at the same time. If you're a woman who needs radiation, regardless, then you would not have the option of reconstruction at the same time as your surgery. You would have to wait, do the radiation, get and do expanders, and then get your implants put in later. So everybody's journey is a bit different.
Mhm.
And so when you are thinking about your choices or given your options, you always want to think what would be best for you, and also keeping in mind what the doctors have recommended as well. So that's one thing I just wanted to mention there. For
Mhm.
me though, being 39 and diagnosed with cancer at such a young age, I had 10-year-old kids. Literally, I was diagnosed on the 25th of November, 2011. My kids turned 10 on November 27th, 2011. And I had to tell them that I had cancer, because I was going to have to go through major surgery. I was going to lose my hair. Back then, cold capping was not as wide known and widespread as it is now. And cold capping is you wear a really, really cold cap on your head. Like it's like really, really cold. And that helps your follicles so that you don't lose your hair. And we
Oh.
do the same yeah, so we do the same thing with because chemotherapy, sadly, can take our nails off as well.
Mhm.
So on our fingers and our toes, and also cause neuropathy, nerve damage.
Yep.
So when we're doing through chemotherapy, we wear ice gloves, and we also wear ice, like little
Buddies. Yes.
footies. We wear little footies on our feet that are ice cold as well, to prevent the neuropathy and your fingernails. But the cold capping is to help prevent so that you don't have as much hair loss. So for me, again, that was not an option back then, 12 years ago. And cold capping, sadly, not all chemotherapies respond with cold capping. So some
Mhm.
women will lose their hair regardless. But it's always a good idea to look to see if that's an option. But I lost my hair, so I knew that I was going to lose my hair. And that's shocking for 2 10-year-olds. And the
Yes.
other thing was, I had to, tell them in a way that they would understand and give them hope that mom wasn't going to die. Because
Mhm.
up until that point, every person they had ever met had passed from breast cancer. So that was a heavy, heavy thing that
Yes.
I knew. And I knew my chances were pretty good. I was stage 1. I was HER2 positive. I had known that Herceptin was an excellent drug in combination with chemotherapy. So I knew my chances were good, but you still have that fear.
Mhm.
You still have that anxiety in the back of your mind.
Of course.
So as I was going through my journey, I tried to keep things as normal as possible. So I made sure that I got up in the morning with my kids. When they went to school, I went to bed. I did what I needed to do during the day. And then I, you know, said, okay, you've got to get up and be there for when they wake up. And I did the best. I was still running while I was going through chemo until round 3. And I'll
Mm.
tell you what happened. Round 3, I'm running. I've had round 3. I'm going. I'm like, okay, I'm doing it. And then somebody walked by me faster than I was running and thought, okay, maybe,
Aw.
maybe that's not such a good idea anymore. And I had to stop running, sadly. The chemotherapy I had was very cardiotoxic, which means that it affected my heart a little bit as I was
Mm.
going through the journey. Thank goodness my heart was very healthy beforehand. And I didn't, whatever damage occurred, actually, I was able to, once chemotherapy stopped, my heart function actually came back to normal.
Yes.
So that was
Excellent.
a really good thing. So that's why, being healthy, fit, cardio wise, muscular wise, it all actually helped me through the journey. I think I would have suffered a little bit more had I not been as healthy as I was. So, but I did go back to running after my chemotherapy was done. And it was done May 30th in 2012. And then I was able to run my first 5K by October. So
Oh my.
coming full circle, 1 year later, I was
Yes.
back running my 5K. Unfortunately, I did have to stop running because all the medications and things that I had really were difficult and hard on my bones. So
Mm.
whenever I ran, I hurt. So I had to find a different exercise, but I've been able to get back being active like I was before and have not had very many ill effects from it other than the joint pain and the muscle aches from it.
Okay.
So that's sort of my journey in a nutshell.
There's a lot. There's a lot to unpack there.
There's a lot to unpack there.
Mhm. Okay. So you were running,
Yes.
prepping for a half marathon,
Yeah.
and found out that you were sick at a young
Yep.
age.
Yeah. Yeah.
I keep
I
asking
know.
myself, should I ask this question? And I'm going
Ask
to.
it. Yeah.
Do you remember how you felt when it all was put in front of you? The path that you
Oh,
had to take and
yeah. Yeah, it's very true when they say that when you get news like you had cancer,
yeah, the C word.
the n the noise, it's almost like your brain short circuits, and you can't hear very well,
Mhm.
and I wanna say, like, I wanna say, "Oh, yeah, I was so brave. I was so brave. But I wasn't. The minute I was told, the tears just came and could not stop them at all. And I was just utterly devastated. Like, that was not the news that I thought I would hear.
Yeah.
And I even said to the nurse as I was leaving the room, I'm like, I didn't think I'd be doing this at 39 years old.
Well, and you were a nurse at that time too, correct?
Right? Yeah.
So you already had this vast knowledge
Yeah.
behind you
Hmm.
and moving into and we can hear it. We can hear it when you say you know exactly what type of cancer it was and what to look for and yeah. Phew.
Hmm. Yeah. I cried probably that whole week because I was told on a Friday. I cried that whole weekend, like, because it was just so overwhelming. And, I struggled to sleep with the lights off for a long time afterwards because I was so scared of if I fall asleep, will I wake up?
Right.
Because your mortality hits you in the face in that moment when you get told you have cancer,
Mhm.
and there are cancers that are more devastating than others, but it's still, when you hear that word cancer, regardless, it's devastating to you.
Mhm.
And then my next thought was, I don't want to leave my kids,
Right? They just turned 10 or were just turning 10.
right?
twins, no less. So,
Yes. Yeah. So
did,
those are all things that are going through your mind
yeah.
in those moments. And then when the dust kind of settled, after the weekend and I sort of started thinking rationally a little bit again, that's when I made my decision of no, we're going to bilateral mastectomies 100%.
So you mentioned intuition that played a role in this. Did you feel like you had a pretty strong intuition up to that point already?
On some things, yes. On some things, no. So when I
Give me
first felt so when I first felt the lump, I kind of, as I said at the top, I was like, did I really feel that?
right question.
And I doubted it,
Hmm.
but I
Well,
really
you
did
want to
because
doubt it.
yeah, but I will tell you, nobody felt it except for me.
Yeah.
The surgeon didn't feel it. My family doctor didn't feel it. Nobody felt it. I was the only one that knew it was there.
Mhm.
And you feel the lump, you feel the thickening of the tissue, like you feel the thick, like it did feel very thick around it when I examined it more. And once I did that, then I was like, okay, something's there. Something's there that's got to go. That I
Right.
knew. That was loud and clear in my mind. Something's there that's got to go.
Hmm.
So I knew eventually I would have surgery. I knew that was coming down the line, but I didn't know it was going to be that kind of diagnosis. No. And I think part of me, denial, like I said, denial is powerful because maybe I did know in the back of my mind,
Yeah.
but I didn't
You were
want to
there.
believe that that was what was happening.
Yeah.
Again, I'm 39 years old,
Right.
right? I'm like, what do you mean I've got cancer? What are you talking? You're crazy. You've got somebody else's file. Like even one time I remember sitting in the room waiting to see my oncologist for a routine appointment. And I'm looking and there's this young gentleman in the room right across from me. And I clearly he got a devastating diagnosis. He was upset. His wife was consoling him. I'm like, I feel so bad for him. My husband looks at me, he's like, hello.
Right. What about
We're
yourself?
here. What
Yeah.
are you busy? Like, no, you're doing this too, you know? And just things like that. It's funny. But yeah, no, my intuition, getting back to that intuition, sometimes I doubted it a lot, like I did with the lump. But then there were other times that were so darn clear.
Yeah.
Like, this is the right path for me. This is what I need to be doing. This is when I'm going to self advocate for myself and say, no, I want bilateral mastectomies. I don't want a lumpectomy.
Hmm.
Because at the beginning, I would have just gone along with anything because I was just so devastated. I would, yeah, do whatever.
Hmm.
But then when I thought about it logically, I went, no, that's a lumpectomy is not for me. This is the path.
Right.
And then I went with it. And I don't regret my decision one bit.
Well, finding out that you had precancer cells in the left breast is kind of the solidifying factor.
Yes.
Would have been like,
Yes.
yes, I know what I'm doing. My body. Oh,
Yep. But
man.
then there's
Yeah.
other times in life where we get faced with something and we question our intuition and we're like, am I making the right choice?
Hmm.
Right.
Right.
But
Yes.
deep down, we have to listen to that intuition because that's our guide
Yes.
in most cases. Whenever you feel like you're doing something or you're presented with a difficult decision and you're trying to make a decision one way and you keep hitting a wall, and it's like you're going through muck, that generally is my cue for that's probably not the right decision because you're hitting a wall.
Hmm.
What
Yes.
about this way? Is
Brilliant.
this way easier? Is this because whenever we're on the right path or the right track, I feel like it's easier.
Yes.
Some of the
That is.
decisions might be hard, but the path getting there is easier.
Yes.
So when
It
I
should be
decided to
easy.
do, yeah, it should be easy. When I decided to do the mastectomies, all of a sudden I met the resource nurse for plastics who's like, we're doing this new procedure with the reconstruction.
Hmm.
Let me, set up a meeting with the plastic surgeon. Great. 2 minutes, 2 days later, I was in with the plastic surgeon. He's like, yeah, we're doing this brand new procedure. We're using this thing called alloderm. We're going to, put these implants in. Great. That was easy. Then it came time for surgery. The surgeon and the plastic surgeon managed to meet. figure out their schedule so that I could have this procedure. That was easy. Literally within 2 weeks, I'd had the surgery of diagnosis. From diagnosis to surgery was 2 weeks.
That's brilliant. That that's the way it should be. I've heard horror
Yes.
stories of other people's experiences, but I love that that's what happened for you and that you're able to share this with all of us because I don't know about you guys, but when I'm sitting here hearing Tracy say, like, I went and did a breast exam. Now I'm like, okay, I'm going to pause this and we're going to go do a breast exam now. It's
This is
time.
your cue to do
Right?
your breast exam because, like I said, we know what our breasts feel like intimately, or we
Yeah.
should. Because the
Yep.
reality is like I said, nobody felt it but me because I knew what my breasts felt like. I knew that it felt different. And that's what we all need to do. And even though I have bilateral mastectomies, I still do breast exams because they can't take all the tissue. There's
Yep.
still 1% breast tissue still here. So you still, even with mastectomies, you still have to be diligent and feel and get used to what it feels like. What does it feel like with the implant in? What does it feel like around the armpit? What does it feel like with this little here bit of, because this is all tissue.
Mhm.
So you need to still be intimate with your body to know what it feels like when something's different, because that's what's going to tell you something's off. And so you
Was
got to
there
get used to it.
was there ever a moment where you were like, and this is human nature, so I'm bringing
Mhm.
it up because this is human nature. Was there something you could have blamed for why this
No.
happened to you? Mom
Well,
passed it on
I
down to me. I can blame it there, or
I
I was
could
really
I could blame genetics. Yeah, I could blame genetics for sure. The reality is, though, there's nothing you can do about that.
yeah.
We have zero control when anytime you get cancer, there isn't one. I mean, obviously, there's risk factors. So if you are a smoker, if you are drink excessive alcohol, more than 2 drinks a week, constantly eat cold cuts. Those are like the three top things that, yes, definitely increase your cancer risk for sure. For me, I mean, yeah, I could have blamed genetics 100%, but for me, that never occurred to me because, again, it's not something I can control. So I never thought, why me?
Okay.
I never, there were times where I was, not happy and I was a little bit upset about the situation, but it was never a why me situation because that didn't serve me.
Mhm.
I felt it did not serve me in order for me to be able to be as positive as I could, trust the process, trust what the doctors were telling me, trust the medical system that I, am a part of, that
Mhm.
they are going to do everything they can to give me the best chance of survival. And so that's what I did. I mean,
Yeah.
yeah, I could have been upset and angry and carried up, but it didn't serve me. I felt it wouldn't have served me. And
That's
that's
beautiful.
just not something I can control.
Right. Control the controllables. Yeah, absolutely.
Yeah. So that's what I did. I controlled what I did. I controlled how I responded to things. Sometimes I was not in a great place mentally. And so, I would seek help for that because, there were times where it was a struggle, am I going to die? Especially after. It's interesting how when you're going through treatment, you have all the doctors and the nurses and everybody's looking after you, social work. If you, want to speak to a chaplain, there's one always available. So you have all these people that are, taking you in their arms and literally carrying you through all this treatment. But when you're done, there's no, and they're like, okay, you're done now. Go live your life. And you're like,
Mm. This
what just
life is
happened?
different.
Right?
Yeah.
Your perception of yourself is different
Mhm.
because your body has changed.
Yes.
Right? Your perception of life is different because you understand how incredibly fragile it is.
Mhm.
You also are yearning to go back to the person you were before, except that person doesn't exist.
Mhm.
And so you have to grieve that loss of your body parts, loss of who you were before. And how do you go forward?
Mhm.
How do you go from A to B now that all these people are like, see you, bye, and you're like on this island? I always say to people, it's like being on an island by yourself because everybody around you is like, okay, you're done treatment, you're fine now. And
Yeah.
you're like, I don't feel fine.
Right.
I feel like I'm this close to losing my mind because you're so close to, the fear, the anxiety that, oh my God, what if it comes back?
Yes.
And so for probably a year and a half after my treatment, I had a port put in because I was going for Herceptin for a year after my chemo. So I had a port put in and I waited till a year after that to even consider taking that out because I was afraid, well, if it comes back, I'm just going to have to get it put back in. So what's the point of taking it out? So I kept it there and then I took it out eventually. And I didn't feel like I could really take a deep breath until I hit the 5-year mark.
Wow.
Because it was almost like when I got to the 5-year mark, okay, you're doing
Like,
okay. Everything's good. You can take a deep breath. And then when I hit the 10-year mark, I was like, okay, you're at 10 years. If you get cancer again, you're gonna be considered ground zero again. You're gonna be curable
Mhm.
again. So heaven
Wow.
forbid, I hope I never have to do it again. But these are the things that we think about
Yeah.
and we struggle with afterwards. You watch social media, you watch the news, and it's like, eat this, don't eat that, don't eat that, don't eat this, eat that, eat this, don't eat that. And you're so confused. It's like, "Well, but I was eating all the good things before and I still got cancer. But now I'm afraid of everything." And then I thought to myself, you know what? Life is too short. Every once in a while, guess what? I'm going to have a freaking cookie. I'm going to have that cheesecake. Because
Yes.
why not? I'm not eating it every day or
Exactly.
every
It's in
minute.
moderation.
It's in moderation. And that's what I had to come with because at the beginning, you're just grasping. You're
Yeah.
literally grasping at everything just to figure out what's going to help me get to that 5-year mark, that 10-year mark. What's going to help me?
Mhm.
And then I had to deal with my emotional aspect of things, the anxiety, the fear. Like it can bubble over into life when you become so afraid because then if you become that afraid, you don't live.
Right.
And that's a
That
shame because you need to live because this life is short
yes.
and you don't want to be held back by something like fear and anxiety. So I had to learn tools of how to deal with that anxiety and that fear so that I'm not, you know, living in a cage of it and not living my life with my family and my husband and my kids
Mhm.
and not putting that fear onto them
Which
because
is
we
a
can do that
tricky
too.
yes, that's a tricky game right there.
Yeah.
This is one of the reasons why you do some of the work that you do now,
Mm.
right?
Yes.
Can
Yes.
you share with us a little about what you're doing to help people who have gotten to the other side of cancer?
So what I do is I'm a cancer coach. And so I help people in that survivorship phase so that they can have the tools that took me years to learn right up front. So we go over nutrition. I'm doing actually a nutrition course with a group of cancer survivors right now. Nutrition, we go over the emotional aspect of it, give you the tools to learn how to recope with life again and how to move forward with it. And then
Mhm.
when certain things trigger you, then how do you deal with those triggers?
Yeah.
And then what we do is we look at how do you want to go forward? What are some things and goals that you want to do in your life, whether it's short or long? And what do you want to do and how are we going to get you there? And so the support that I provide gives people that time over the 3 months, 6 months that we work together, that they have that person that's alongside them and supporting them as they go through that next phase, figuring out who they are now, what they want to do, what are their passions, what are their interests now, what are their strengths now, in order for them to move forward and give them those tools. And so that's why I love doing what I'm doing. And that's why I created the program I did, was because I remember what it was like to be on that island by myself. And it was pretty darn lonely for a while. And I don't want people to go through that. I
That's
want them to
beautiful.
have that support and have that person that they can go to and understand where they've
Mhm.
been, because I
Yes,
understand exactly where they've been.
that's you're filling a role that is obviously desperately needed. I have another friend
Very.
who works as a PA in oncology, and she's
Mhm.
doing kind of work. And when you think about how many people out there are that have survived cancer, and then you think
Yes.
about the number of people who are doing cancer coaching, it doesn't that there's not enough of you. So thank you.
No. You're welcome. It's my
Yes.
pleasure, because like I said, I do it because I know what it was like for me, and I don't want others to go through that same anxiety and stress, and, you know, get them back to being themselves, going from being a patient to a person again.
Mhm.
So, so important, because you can get stuck there. You can get stuck in that patient role. And
Yes.
I've met some of my clients. I had one client who 12 years, she was she was stuck there. And when I met her, I remember the first call we had together, she was so sad. And I said, "We're gonna do this." By the end, when we were finished, her voice didn't even sound the same. She was laughing, she was happy. She had lost the weight, some of the weight that she put on during chemo, and still 12 years later struggled to get off. And she had a better understanding of how to cope with life, and she was thriving, and it was so wonderful to see and hear, because when you make that change and start figuring out who you are, it's so rewarding. It's so, like, I just love doing it.
It's beautiful. Ah, Tracy, you have a podcast. I happen to
I
be on it.
do.
Will you
You
share a little
were.
will you share a little bit about your podcast also so the listeners can go and find your podcast as well?
So my podcast is called What Has Changed Your Life? And there are so many incredible people on there that I've interviewed, including Amanda, about their journeys and what they've been through, and what lessons they learned from it, and how it changed their life, and the positive aspects of that change. And there's all kinds of, any type of story that you can think of, it's there. And I would love for you to go and listen to all these inspiring people and how they basically triumphed over what was going on in their life and thrived. And that's my hope for the podcast, is it gives people hope in life, that they too can endure something, because life is hills and valleys. It's not linear. And there will be times where we are hitting the wall. And I hope these podcasts give people some inspiration.
It's yes, and it's fairly obvious now why that is the name of your podcast and why
Yeah.
you do what you do. So, Tracy, oh my gosh, thank you so unbelievably much for 1, being on my podcast, 2, for the work that you do in the world, and 3, for inspiring people in your podcast. Thank you.
Thank you. Thank you for having me. I appreciate you taking the time to hear my journey.
Of course, absolutely. I couldn't pass up the opportunity because I knew it was gonna be a good one. Where can people find you?
I am all over social media. On Facebook, I am Tracy Frankland, Frankland. I'm on TikTok as Tracy Cancer Coach. Cancer Coach. Apparently, I can't talk.
Right at the end.
um, I know Instagram. I'm Transforme Coaching. Transforme Coaching, and also you'll find that on TikTok, Transforme Coaching as well. I have a website, transformecoaching.ca. So drop me a line there, or on any of my social media platforms. You can find me. LinkedIn, IG, I'm all over.
I will be sure to put all of those in the show notes so everybody can go and find you in those places. If you know someone that's been through cancer, send them to Tracy. If you are someone who's going through cancer, know that there is a coach on the other side of this.
Yes.
Tracy, thank you.
Thank you, Amanda. Thank you, everybody, for listening.
Thanks for listening to Spirit of an Athlete podcast. If you're struggling with your own gut issues and want more direction, you can get an initial body scan from Amanda at bodywhisperhealing.com. In 20 minutes, you can find out what's wrong, get clarity, map the path forward, and get on track to get back in your game. If this episode hits the spot, please let us know by rating, reviewing, and sharing it with a friend. Subscribe now to hear more inspiring stories from other female college athletes who overcame their health issues. Want more, Amanda? Get inspired by finding more at bodywhisperhealing.com.